Good day, Trinidad and Tobago, and thank you for tuning in to another virtual media conference hosted by the Ministry of Health, where we provide an update on the national COVID 19 response. And today, 1st November 2021, we will be starting the update. We have this morning Dr. Avery Hines, Technical Director, Epidemiology Division, Ministry of Health, Dr. Asante LeBlanc, Chairman of the Trinidad and Tobago Cancer Society, and Nurse Josette Smith-Bethel, ICU nurse at the Couva Hospital. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health and your moderator for today. We begin with Dr. Hines, who will present the clinical and epidemiological updates. Dr. Hines.
Thank you, Mr. Alexander. Good morning to my colleagues, Dr. Asante LeBlanc and Nurse Bethel. Good morning to members of the media, members of the viewing and listening public. If we can go straight to the update slide, we'll present the data as at October 31st at 4 p.m. At that time and date, we had a cumulative total of 57,329 total positive cases, and those were broken down as follows. 50,732 already recovered, 4,901 total active positive cases, and of those total active positive cases, 4,327 are in home self-isolation, 336 are in hospital, and 30 are in step-down facilities. And we have 208 new positive cases that would have been diagnosed and reported in the last 24 hours, and 1,696 total fatalities, and we extend our condolences to the members of those bereaved families. Looking at the vaccination coverage, the vaccination drive, you would note that total individuals vaccinated with one dose, or the first dose of a two-dose regimen, has now reached 623,164. We also have individuals who have received one dose of the single-dose regimen, that is the Johnson & Johnson. Those individuals currently number 34,943, and the total persons who would have received their completed or second dose of a two-dose regimen would be 566,848, bringing total persons with a completed vaccination regimen to 601,791. And looking at the cumulative percentage of individuals in the parallel healthcare system who are at this point not fully vaccinated between July 22nd and October 13th, we note that 93.7, nearly 94% of the persons at the parallel healthcare system are not fully vaccinated. Let's move straight into the epidemic curve. What we will see here is the gray section over to the left, representing the months from July through December 2020. This is the last time we'll see that section of the graph as we make some space for the remainder of 2020. So that gray section is last year's data. You see that the colored sections, beginning with January in the dark green, move all the way through to light green for the now completed month of October. And if we look at the dotted line of the rolling average going through that graph, you'll see that there's a bit of an upward slant to that rolling average that we've noted throughout the month of October from the start. And that increase in rolling average is something that we've been alluding to and speaking to with regard to the cumulative totals on a weekly and on a monthly basis. We'll be seeing that slow but now steady upward trend. Let's go to the next graph, where we look at the same data now at a weekly level. Weekly aggregated data, if you look at the heights of the green bars, we see that weekly aggregated data, those bars have been getting progressively taller instead of fluctuating sort of up and down as had been going on for the last or the previous 10 weeks. We've now seen 3 weeks of continuous either exactly the same or very close to the same or increased totals from one week to the next. So that increasing trend, that upward trend, that has now begun to hold steady is what we've been speaking about throughout the month of October, that we've been noting. And if you look at the background salmon section, that section which is the positivity percentage of total COVID tests that come back as positive, that has hovered between 25 and 30% throughout. If we go to the next slide where we aggregate the same data now at a monthly basis, we see what that looks like for the month of October, where the month of October, that bright green bar at the end, now basically has exceeded, though slightly, but it has exceeded the totals for July, August, and September. So that upward trend that we had been speaking about has basically manifested itself as a higher cumulative total for October than for the preceding 3 months. We also note that the background section, that salmon section representing positivity, again in this at this time scale holds at that 25 to 30%, but we do see that a little bit of an upward trend in the month of October compared to the month of September. Let's move to the next slide. Looking at the demographics, this is cumulative from the beginning of community spread. We've noted that the individuals getting ill remain in that sort of working active age group in the majority. 25 to 49 years is about half of the total positives, and we note that the male-female balances remained about 50-50 throughout. At this point, 49% male and 51% female. Moving to the next graph, the fatalities have a different pattern, and that pattern shows that more than two-thirds of them are in the over 60 age group. The male-female balance is a little different. It is about 57% men and 43% women. And while not shown on the graph, one of the facts that we emphasize is that also among the fatalities, we noted that individuals with pre-existing conditions, or what we call comorbidities, were at higher risk of having those adverse outcomes. We also take the time at this juncture to reinforce that individuals with pre-existing conditions are individuals who benefit from vaccination, because vaccination reduces your risk of adverse outcomes when or if you encounter the COVID-19 virus. Moving to the next slide, we see basically just the geographic distribution by community, and if we move to the next, we look at that same information now at a county level in the next slide, and we see that we're comparing 1 week with the next, the purple being previous week and gold being current. And we do note that for each county, the majority, with two exceptions, the majority of counties did see an increase in their cumulative totals between 1 week and the next, between week 41 in purple and week 42 in gold. And the fact that the majority of the counties have seen an increase reflected itself in the overall increasing trend that we saw from week 41 to 42. So we are noting that across the country, we are seeing increases in the numbers of new cases. And if we go to the next slide, we will see that whereas there had been fluctuations and in some cases even something resembling a downward trend over at least the last 3 weeks, in most counties we've seen progressively increasing totals, going from the third to last to second to last last of the bars in each grouping. For Caroni, for Nirvamero, etc., we see that bit of an upward trend, again indicating that we're starting to see increases across the board. So that brings me to the end of the clinical and epidemiological updates. I'm going to turn it back over to Mr. Alexander.
Thank you, Dr. Hines. The Ministry of Health continues to enjoy a very positive relationship with partner associations and organizations. And this morning is no different, as we are pleased to welcome the chairman of the TNT Cancer Society, Dr. LeBlanc. Good morning.
Thanks, Al. Good morning. Dr. Hines, Nurse Bethel, members of the media, viewing and listening public, good morning. Losing a loved one to any disease is traumatic. Losing a loved one to a disease owing to fear, ignorance, and misinformation is even more traumatic. Cancer is one of the major lifestyle diseases, or NCDs, and although it may not be thought of as such, it is one of the comorbid conditions that you have been hearing about when we speak about COVID-19. Cancer patients are considered part of the high-risk group when we speak about COVID-19 infections. There's a notable increase in the risk of complications and death in this group when infected by the SARS-CoV-2 virus, and even more risk with the Delta variant, which is currently in our community. We at the Trinidad and Tobago Cancer Society always remind the population to give yourselves a fighting chance through healthy lifestyles and screening. Today, we ask all of our cancer community to give yourself a fighting chance against COVID-19, and along with the 3 W's, add the V and get vaccinated. I can understand the fear, the hesitancy, and the uncertainty. Truly, I can. But at the same time, I ask that you speak to your doctors, get the correct information, and get vaccinated. We hear a common theme. We don't know enough about the COVID vaccines. The vaccines will kill you. You can still get sick if you take the vaccine, and the list goes on. But we do have historical data since 2002 on these vaccines, as they were first created to combat the SARS and MERS epidemic in Asia and the Middle East, respectively. We know that the vaccines against the COVID-19 virus provide an added layer of protection. We know that it provides a 97% reduction in your having a complication or death due to the COVID-19 infection. Can I tell you what we truly may not know? We do not know what the SARS-CoV virus is capable of if you do get infected by it. We know that this virus has up to a 25% chance of causing death or complications in cancer patients, the high-risk group. This vaccine allows your body to have a jump start on recognizing the virus, and therefore allows your immune system to be ready and waiting, and therefore much more effective in fighting and clearing the virus from your body. The vaccine allows for a reduced risk of transmission of the virus, so we protect those who cannot take the vaccine, and it allows for milder disease should you get infected. Cancer is already a battle that your body has to fight. We always speak about how to help your body through this journey with cancer to conquer and to survive. But not only do you now have to worry about dealing with cancer, treatments, emotions that are raging, but we also have COVID-19. Let us help you worry less. Let us truly protect our most vulnerable. I know that there's a lot of misinformation out there, but it is known at this time that cancer patients are eligible and encouraged to get vaccinated. There are very specific situations where the vaccination schedule is delayed, and these situations are highlighted by your oncologist. Most commonly, it is if you are currently undergoing active radiation treatment, which will suppress your immune system, and therefore we will delay your schedule. But please have that discussion with your oncologist or your oncology team. But ladies and gentlemen, I am not here only to speak to cancer patients, but most importantly to their relatives and caregivers, their support circles. You're there for your loved ones, helping them through this journey with their disease. But if you're not vaccinated, you are in fact potentially able to cause more harm than good. This has been converted into a pandemic of the unvaccinated to a large degree. We cannot afford to lose this fight now owing to misinformation and division of our population. My last and most important advice to you today is the importance of screening. Along with maintaining healthy lifestyles, we implore and encourage you, both men and women, not to delay your screening. We have seen that a delay in screening due to COVID-19 has happened over the past year, and it's because of the COVID-19 presence in our community. As long as you are not symptomatic, that means you have no symptoms, you have not had a recent contact with a confirmed COVID-19 patient, and your screening is due, kindly reach out to your health centers, your healthcare practitioners, and the Trinidad and Tobago Cancer Society for your screening. Screening allows for early detection, and along with maintaining healthy lifestyles, it will allow for an increase in survivorship, our best weapon against cancer. Get screened for prostate cancer, cervical cancer, breast cancer, and colorectal cancer. This is a global fight against cancer, and now cancer and COVID-19. We have to do this, and we can do this. Healthy lifestyle choices, get screened, the 3 W's, and get vaccinated. Thank you so much.
And thank you very much, Dr. LeBlanc. Dr. LeBlanc literally just came straight off a plane and to the studio, and we want to thank her for her coming on and attending the press conference. I now hand you over to Nurse Smith Bethel, who will provide us with an insight into what happens on a COVID ICU ward, the challenges faced by nurses, doctors, and more, so the unvaccinated COVID positive patient who ends up in the ICU. Please.
Thank you, Al. Thank you, Al. Good morning, Dr. Hines, Dr. LeBlanc, members of the media, and to our viewing and listening public. I am Josette Smith Bethel, a registered nurse and one of the team leads attached to the ICU at the Couva Medical and Multi-Training Facility for the last year. I am grateful for the opportunity to share a glimpse of what a day in the COVID ICU is like, in the hope that it would encourage persons who are still unvaccinated to get vaccinated. On any given day, I am donned in my personal protective equipment, or PPE, which is what I wear as a measure of protection against this deadly virus while in the hot zone. On arrival into the hot zone, I would take over my assigned suite from the nurse on the previous shift. The patients in my care vary in ages. Some are children, young, middle-aged, and elderly, and are very critical. They require high levels of oxygen via face masks or mechanical ventilation. Unless you are actually in there, you could never imagine what goes on in the ICU. Our ICU can house 22 patients, and we have recently extended and increased our capacity to house approximately 19 extra patients. Patients in the ICU need continuous monitoring with a cocktail of medication, but we could only do so much. A patient's status could change without warning, and sometimes relatives would be asked to make what could be life-changing decisions on behalf of their loved ones. And as nurses, it's hard because we are the ones tasked with ensuring that we do what is required to keep their relative alive. Relatives, we empathize with you, but please know that we are doing our best. We do everything for our patients. We give them baths and we feed them. We sometimes even ensure that relatives receive a phone call or a video call, because the harsh reality is it may very well be their last. A day in the ICU is physically and emotionally exhausting. We are just going. We are not able to eat. We are not able to drink or even use the bathroom. We can spend anywhere from 6 to 8 hours, sometimes 12 hours in full PPE just to ensure that the needs of our patients are met. We too have families. Some of us have children at home doing online schooling, and we are not there to guide them. On our days off, we sleep and regroup to do it all over again. However, on my days off, I am thinking about my patients, wondering, are they still going to be there when I get back? I could recall working with a 26-year-old male. He said, "Nursey, I could video call my relatives." I said, "Sure you can. How else would they see you? It's the only form of communication you all have right now." He replied, "Thank you, Nursey. You're doing a good job. Keep it up." On that day, I left him receiving oxygen therapy via a non-rebreather mask, alternating with what we call non-invasive CPAP. He was doing well. He was one patient that I was certain would be able to leave ICU and return to his family. However, that was not the case. Unfortunately, his condition worsened, resulting in him being orally intubated and mechanically ventilated, and eventually succumbing to COVID-19 a couple days later. I felt that, because I told him, talk to them all you want, because not many people get to do that. I have always loved being a nurse. I believe it's my calling. But the last couple of months have definitely made me question my career choice. At this time, being a registered nurse in a pandemic has become extremely overwhelming. I particularly feel it for the nurses who started their careers during this pandemic. They, or we, are going to be scarred. Some, if not all of us, are already traumatized. We have seen so much death, and we know that there is going to be more. It hits real hard when we lose our own. We have lost family members. We have lost friends. We have lost so many people to COVID 19. Some say we are superheroes in scrubs. So let's continue to fight. I am not giving up. We are not giving up. To all of my colleagues, you all are amazing and never forget that. I know it is a lot, but we are strong and we are resilient. So to you, I say thank you, thank you, thank you. Thank you for your service. To sweet TNT, my sweet TNT, there is no cure for COVID and we are exhausted. We need you to take personal responsibility. You do not want to end up in the ICU. COVID 19 is heart wrenching and it is destroying families. So I urge you to protect yourself, protect your family, protect your community, and let us end this pandemic for good. Don't delay. Get vaccinated today. Thank you.
And thank you very much, Nurse Bethel. We will now move to our question and answer segment. Members of the media, please indicate your name and the media house that you represent before posing questions. And in the interest of time, we ask for a maximum of 2 questions per media house initially. We will take our first question from AZP News.
Hi,
AZP,
good morning.
Yes,
This is
good
Swan
morning.
Wayo from azpnews.com. And my questions are to Dr. Hines. Given that Diwali is this week and we are also entering into the Christmas season, there seems to be an increased foot traffic in key shopping areas. Will the Ministry of Health be expecting an even more increase in COVID-19 cases from here on into December? And if so, what measures are being undertaken to deal with it? Additionally, now that the US has made vaccination mandatory for entry into that particular countries, other countries may also be implementing that measure. Does the ministry anticipate an increase in vaccination due to this particular measure? Thank you very much.
Okay, thank you for the 2 questions. I think I will go in reverse order. If the demands of travel for other countries requesting vaccination as a criterion for entry into their borders is something that will drive vaccination here, then we're quite happy to have that increase driven by whatever encouraging factors there are. It would be hoped, however, that what would drive our increase in vaccination would be a better understanding of the benefits of being vaccinated. We've spoken about the vaccinations improving your probability of survival if you do get COVID 19. We've spoken about the vaccinations in particular being a benefit for those who have comorbid conditions. We spoke about them in terms of diabetes, we spoke about them in terms of cancer, we've spoken about them in terms of the range of comorbid conditions. And we would hope that that would be more of an encouraging factor than the need for a vaccine for travel. But we'll take whatever encouragement will and will get the population to continue along the trend of getting as much vaccination into the population as possible. With respect to your first question, we do note that there will be additional movement. We are seeing the additional movements even before now, and we note that as we go into the festive season, more movement is expected. We also note that we have been providing guidance and guidelines on how to reduce the risk of transmission, even as we move about more, engage in more economic activity, and those guidelines haven't changed. We do hope that as people move around more, they will definitely be stringent in their adherence to those guidelines, keeping their masks on, washing their hands, not crowding spaces, and of course, the added benefit, the added layer of protection of getting vaccinated is the drive that we're really on to ensure that as many people as possible have the lowest risk possible of contracting and transmitting the virus. So we're hoping that even as we have additional movement, we'll have additional vaccination, and we will have a braking force applied to that increased tendency for transmission as people move about. So hopefully that answers both your questions.
Thank you, Dr. Hines. We go now to Guardian Media Limited. for your questions.
Hi, morning everyone. Rashad Khan, Guardian Media Limited. My questions are for Dr. Hines. Dr. Hines, in light of October, we're seeing this increase that's more than the previous 3 months. I'm just thinking back as to what happened differently over this month. And we saw the reopening of schools, the return to classes, and we also saw the Safe Zone initiative being implemented. So how much or is the data pointing towards these changes resulting in that increase in cases locally? And my second one isn't so much a question, but I would like to see at some point, Dr. Hines, if possible, the same way that you break down the epidemiological data with the GIS and these graphs, I would like to see something like that translated to vaccination so we could see the breakdown of the demographics and that sort of thing. Thank you.
Okay, so your second point is noted. And with respect to the first, you would note that we had been commenting on this increase. And if you look at the actual data, you'd see that the gradual increase, we've actually been seeing since the start of October, which actually predates some of the measures or the relaxations that you have noted. So while that increase has been steadily noted from the start of October, any additional movement of and mixing of people will contribute to the additional risk of increased rates of transmission. And the only things that we can do at this point to reduce those risks would be to continue to drive towards higher levels of vaccination in that mobile population and higher or greater levels of adherence to those other guidelines that will really help us to slow spread. Keeping on the masks, not crowding indoor spaces, keeping our hands clean, not touching our faces. That as simple as it sounds, all of those forces together add layers of protection that reduce the risk of one person being able to transmit COVID-19 to another. So yes, we do expect that as there's more movement, there is a greater risk, but we're hoping that that's going to be balanced off by more adherence and more vaccination, because that is really the only way to continue to apply that braking force to the upward trend that we're seeing.
Thank you very much. We now go to the Newsday. We're ready for your questions.
Hi, good morning, everyone. I am Tyrell Gittins from the Trinidad and Tobago Newsday. This question is for Dr. Hines. What mechanisms are in place to monitor the spread of COVID-19 among the socially displaced? And in addition to that question, of the total number of cases and deaths, how many were socially displaced individuals?
Okay, thanks for the questions. We'll start with the second one first. Because the level of social displacement isn't one of the things that is necessarily reported all the way up to our division, we can't actually answer how many of those individuals who would have either contracted COVID-19 or would have died would be socially displaced individuals. The Ministries of Social Development and the other ministries that interface with and interact with the socially displaced in terms of providing shelter and providing food, etc., would be the ones that would provide some sort of monitoring of who is ill and referring as needed to the healthcare system. But that monitoring doesn't necessarily come with a calculation component. It's just really a measure of ensuring that people aren't ill, that if they are, they're referred appropriately, but they're not being quantified as a separate subgroup at this point in time.
Thank you very much, Dr. Hines. We now go to CL Communications. We're ready for your questions.
Good morning, Natalie Singh, Caribbean Lifestyle Communications. I just have two minor questions, probably for Dr. Hines. We've seen an increase in Delta variant cases, right? And I was just wondering, in such a short space of time, relative to the increase in the Delta cases, I was just wondering, is this worrying the Ministry of Health and officials? And is there anything further you're going to do to make sure that everything is in place with regards to resources to assist in the response to this increase in Delta cases specifically? And then secondly, just I needed to talk again about the Safe Zone initiative. so that the public gets it very clear. With the feedback we're getting is that it's not quite clear just yet. Thank you.
Okay, so with respect to the Delta cases, yes, we do note that we have increasing numbers of Delta cases that we have detected. We've also made the point that there will be increasing numbers of Delta cases that we have not detected, and that this really represents the tendency of this particular variant very quickly to establish itself as the dominant circulating variant. While we wouldn't yet say that that is the case, it is very likely to become the case because the Delta variant in other countries has demonstrated that same tendency, the tendency to displace whatever else is circulating. But that tendency may be to some extent offset by the fact that what was circulating in our population before was the Gamma variant, which is a fairly good competitor. What's more important, though, is that regardless of which variant of COVID-19, which variant of the SARS-CoV-2 virus is in circulation, the measures for reducing risk remain the same. There aren't additional measures that we would need to implement de novo from scratch, because the measures that we already have in place are the ones that would need to continue to be strengthened. And on the side of the parallel healthcare system, all is being done within the constraints of the resources available to make as much care possible to as many people as require it. And of course, the ability to extend or expand that is finite. It's based on resources, but those resources are being mobilized in the best possible way to provide the best possible care to the largest or widest cross section of the population. So I hope that answers the first question. Your second question is equally unclear to me. I'm not sure what is still not clear about the Safe Zone initiative, but the documentation, I believe, resides on the Ministry of Health website and other websites. So if there is something that is unclear, I would advise that we refer to the documentation and then specify what exactly remains unclear at this point in time.
Thank you, Dr. Hines. At TV6, we are ready for your questions. Good morning, TV6.
Good morning, Renessa Cutting, TV6 News.
Yes.
Ms. Smith Bethel, I just want to say that my paws raised as you were speaking, and I really empathize with you and your colleagues. And of course, I'm sure the entire country thanks you for your service. But as I was listening to you, I couldn't help but think of the pleas and the plights of nurses as voiced by the TTRNA. And so my question to you is, what workable solutions can you proffer in terms of improving service delivery and conditions of nurses and working conditions, especially in the parallel healthcare system? And do you generally feel valued given the psychological and physical pressure that you all work under? And my next question, I guess, could be directed to Mr. Hines. But given that the FDA has now given authorization for Pfizer to be used in children ages 5 to 11, how does that influence our consideration, Trinidad and Tobago's consideration to a COVID mandate for school-age children of that age? Thank you.
Okay, thank you. I will take your second question first. So FDA's approval is basically a national level approval for the United States. As additional data is collected and collated, analyzed, and then a consensus position is developed by the WHO, which is the group to which we refer for global mandates, global guidelines on existing evidence. When that comes through, then our existing policies will be modified in accordance with that global guidance. It's important to note that the WHO is taking data from multiple studies from all over the world, and that the international group that sits and reviews this data comes to a consensus and provides guidelines, provides very robust review of the data, and we rely on that as a global guidance before we make any modifications. Now, I'm going to just dive partially into the question asked to Ms. Bethel, because the issues are on policies and working conditions wouldn't really fall to her, but those would be conditions and questions that would be directed to either the CEOs or the other heads of the RHAs who do the hiring. So I'm going to redirect that and allow her to answer the question on feelings of value, etc., because that would be more along the lines of response that she can provide.
So, in respect to us feeling valued, we feel the love at times, but the reality is we're tired and we're seeing, or it seems to us though as there's no end. So we're constantly going, and what more could we do? But we appreciate the love that we do get from from the public, from relatives, from upper management, but we would appreciate it greater if you guys go out and get vaccinated so that, hey, our workload could decrease a bit, you know. But the love is there. We know that we are appreciated, but we would like to get some more, but it is what it is, and we are doing what is expected of us as nurses and as healthcare professionals.
Thank you very much, Ms. Bethel. And we go back to Guardian Media Limited for a follow-up question.
Hi, morning. Thank you again. Dr. Hines, would you be able to say how many outbreaks we've had in secondary schools so far since schools have reopened?
At this point, not yet, and that is because that information is being directly monitored by the health team that operates under the purview of the Ministry of Education. That information has to be compiled and sent upwards, but it is under constant monitoring by that unit, and that unit is ably assisted and supported by the county medical offices of health in ensuring that you don't have a situation that gets out of control. So that work is ongoing. But at this point in time, I wouldn't be able to present any data on that occurrence, bearing in mind also that it's only been a week. So because it's only been a week, it's still a bit early to start making comments along those lines just yet. But we will most certainly keep the population updated on any changes in trend that we notice.
Thank you very much, Dr. Hines. We do have a question coming in from the members of the public, a member of the public. To Nurse Bethel, do smokers experience greater challenges in the ICU?
I would say yes, they do, because we know that smoking already affects the lungs. It builds up the tar around the lungs, which decreases the potential for the lungs to effectively allow for gaseous exchange. So, COVID 19 being a respiratory disease makes it even worse, especially if you're a chronic smoker. So, smokers, y'all need to ease up because y'all are affected greatly, by COVID 19, and your stay, should you end up in ICU, would be very long.
Thank you very much, Ms. Bethel. We now go back to AZP News for a follow-up question.
Hi, good morning. Suana again here. My question is to Nurse Bethel. Do you think there's enough mental support and counseling for healthcare workers? What suggestions might you make for such, given the situation? Thank you.
At this time, I would like to congratulate the management of the NCRHA because they do provide active mental health, psychological assistance to staff, relatives, patients, and patients' relatives. And our psychologists are on call every day, and they are very accessible to us. So our mental health is being looked after. So we have no problems in that regard at this time. We would like to have a break, but yeah, they are there for us, and we appreciate that.
Thank you very much, Ms. Bethel. TV6, we're ready for your follow-up question.
Yeah, Dr. Hines, I know you said that October so far compared to the two previous months has been higher, but considering the entire year, could you say which month had the highest number of cases and how October compares to that month, and what probably are the similarities or any trends you'd have observed? Thank you.
Okay, I don't know if we can pull the monthly graph that we put up today back up onto the screen. That would be, I think, either slide 4 or 5. It's a good question, but I thought that it's a question that we had to some extent demonstrated the answer for. So we would have seen that starting in January of this year, we had small numbers of cases. Can we get that graph back up? And that we rose to having the highest numbers of cases in May. And then, with all of the measures that had been implemented, we started to see a decrease into June, a further decrease into July. And from July, as additional movement began to be seen, there we go, thank you. So let's look at the colors. The colors here, the gold, the tallest bar, the gold bar is the month of May. And next to it, the blue or cyan is the month of June. And then the fuchsia, indigo, and orange are July, August, and September. So we saw that decrease from the month of May when things were at their peak and all the restrictions had been implemented. We had a decrease to June, another decrease into July, and then we actually started opening things up a bit in July, and we saw that decrease level off. So we didn't see continued decreases, but we didn't see increases either. We saw basically similar numbers of cases for July in fuchsia, August in indigo. September actually had slightly smaller numbers in that brownish orange color. And now October, the bright green, we just finished October, we have all 31 days in there, and we see that there is an increase above that plateau, which is what we were speaking about when, if we go back a slide, in fact, go back 2 slides. If we go back 2 slides, we will see we're speaking about that increase in daily rolling average that we saw from the start of October. Right, thank you. We look at that dotted line that we were speaking about. If we could move the bottom third so we can, thank you. If that dotted line represents that rolling average because cases fluctuate from day to day, but you see a little bit of an upward trend sustained throughout October. So although some days the cases weren't as high as other days, there weren't as many lows either, and that overall contributed to that increase in the cumulative total for October. And of course, we're seeing more movement and we're seeing additional economic activity, mixing of groups, and all of this will contribute to the increased risk, the increased opportunity for transmission. And all we can do without trying to impair the economic activity and mobility of the population is to encourage all persons to get their vaccinations. That reduces your risk. Adhere to the public health guidelines, and mask wearing in particular is very important. We see people still not exactly wearing the masks the way they should. They have them under their noses, which is essentially completely useless. That nullifies wearing a mask. The mask isn't a decoration. The mask actually serves a purpose, and that purpose is to reduce your risk of shedding viral loaded droplets. So all of these things are the things that are really in place, need to remain in place as we continue to move around more. And that's the comparison between the highest point that we were at in May and what we are now seeing at the end of October. We're going to continue to monitor that trend and see what happens into the month of November. But the only way to put a break on that trend is, as we keep seeing, raise the vaccination levels, continue the adherence to the public health guidelines.
Thank you, Dr. Hines. I have a question for Dr. LeBlanc. Have you noticed a degree of Yes, sorry, I have a question for Dr. LeBlanc. Have you noticed a degree of vaccine hesitancy from cancer patients? And if so, why?
I'll in the Trinidad and Tobago Cancer Society Survivor Group, we worked very hard to convince them and to educate them on the importance of vaccination. We do, however, note that a lot of cancer patients have a misconception that because they are going through the diagnosis and the treatment of cancer, they cannot be vaccinated. And we want to remind you that you're more vulnerable. You're a high risk group when it comes to the COVID-19 infection. And so we have to consistently remind them on the importance of vaccination. Get the right information. Don't be misinformed. And just don't be afraid. This is our protection for you.
Okay, I just want to jump in here because beyond the individuals who know their status already with regard to cancer diagnoses, we are at the Ministry of Health expanding the screening for cancer via the care fairs that are currently happening. There is prostate screening, there is cervical cancer screening via pap smears, and we want to encourage individuals in the population who don't yet know, who haven't recently screened, who haven't checked their status, to go ahead and make use of both those and the existing facilities in the healthcare system to do the screening, to catch anything that you may have early, because as Dr. LeBlanc would be able to tell you, the earlier you diagnose via screening, the better your chances of treatment and subsequent survival would be. I don't know if Dr. LeBlanc wants to add anything to that.
Dr. Hines, you're totally correct. Screening is definitely the best way because we have early detection, so that means we'll get it in an earlier stage, and therefore your treatment regime and what you're going to have to go through is much less traumatic to you, to your body, and to your mental health. So definitely increase survivorship. And so along with the healthcare fairs, which also offer education on important small lifestyle changes that are so impactful, including no smoking and no vaping, as Nurse Bethel highlighted. So definitely, Dr. Hines, I support the screening anywhere they can get it, especially through the Ministry of Health and the Trinidad and Tobago Cancer Society. Don't hesitate. Screening is where we're looking for a disease in a normal population. The more we look, the more we'll find. But it'll be early detection, and that is your greatest weapon against cancer for increased survivorship.
Thank you very much, Dr. LeBlanc. We go back to Guardian Media Limited for your follow-up question.
Dr. Hines, are you in a position right now to give us an update on what our ICU capacity is like in the parallel healthcare system as of today?
Okay, so as of today, there has been an increase of a few beds within the ICU segment of the parallel healthcare system. 4 additional beds have been activated, so that we now have 58 beds available, of which 52 are filled. So we have 58 beds available, but 52 of those are already filled, and we would note that of the 52 individuals in ICU at this point in time, 50 of those weren't fully vaccinated, so that's 96%. Now, the statement that my colleague Dr. Richards always makes is that it's not just a matter of a physical bed or a space to lie down, but it's all the resources that would need to be amplified in order to have additional ICU capacity that we look at when we say we have 4 additional beds. So the ability to continue to redirect and shuffle resources to increase ICU capacity is limited. But we are, with the resources that we have, trying to make the most of the available resources to increase capacity as demand would require.
Thank you very much, Dr. Hines. Ladies and gentlemen, we have come to the end of today's media conference. Thanks to our presenters, media representatives, and you, our viewing and listening public, for sharing your time with us this morning. I also want to remind the population that vaccines are still available at all 109 health centers across Trinidad and Tobago. And as we leave you with a brief video from the Hot Zone, I invite you and your family to take charge of your health. Don't delay. Vaccinate today.
The Hot Zone.
My name is Dexter Saunders, and we're here at the Covert Hospital. We're actually on the floor of ICU HDU. We'd really prefer not to ever see you guys here. We'd prefer to see you guys on the outside, getting vaccinated, because here is serious business. People die here. It's not easy. Seeing and hearing mothers crying, fathers crying, even some of my colleagues. They call us the frontline workers. This is a wartime term. The war is being fought right